Okay, my name is Philip Melo, and today we'll talk about how we can use public and population data to do some work in the terms of helping a doctor, a nurse to make some conclusions. So to trying to join medical informatics and public health informatics. Okay, I would like to say that in my previous lectures, if you remember, we discussed how to extract data from EHR, from different registries, to put it in another repository in person or in clouds, and many other things. For example, how to use machine learning techniques, artificial intelligence, decision trees, to more accurately predict, monitor various outbreaks and pandemics. And we used how to improve data quality, many things we covered. So today's lecture will not be so difficult at all. So let me just go to the whiteboard. And today, the scope of our lecture will be, as I said, we will use public health, population health data uh, to better, to more accurately identify, to put a diagnosis for patients with lung cancer. So today we'll talk about evaluation of lung cancer using public health data. Now, what I would like to say that it doesn't matter what we do in healthcare informatics, we need some a priori data. And therefore, doctors, for instance, before just looking at the patient, they just go to his or her records, trying to find out the background and other things. In many instances, this background data can be taken from actually even some data from historic data from communities, from population data. For example, some data on income, if they affect the results, demographic data, environmental data, many things that actually public health data uses, and we discuss it in my lectures when we covered the sources in public health data. So suppose now what we are going to do, we would like to evaluate lung cancer in a patient. And what the doctor, before just making tests and various things, the doctor finds out that the person is a smoker. Okay. And he can take some data, as I said, from communities, from other things, and or global data, for example, from population for public data. And we know that in this country, about 20% can be 18, depends on communities, the counties, but in general, 20% of smokers have lung cancer. So this is the first data what we have. You can use some other data if you look at different communities, but it won't change much the results. So let's take this 20% as an example, all right? Now, another thing, what is that the doctor knows that the data comes from medical clinical observation that the X-rays the accuracy to estimate, to actually diagnose to detect lung cancer in patients if they have lung cancer will be 75%. Sometimes this number varies. I look at the literature, it can be 77, 78, but we'll take 75% as an example, all right? So what does it mean, this 75%? If a patient goes for X-rays, and he has or she has lung cancer. So these X-rays with accuracy 75% will identify. So 25% the X-rays will miss. Okay, that's what that means 75%. And what also there is from medical clinical data show that if you take healthy people, then the accuracy will be 95%. So 98, 90, sometimes close to 99. So it's quite accurate. So in healthy people, X-rays won't detect anything. So this means 98%. And only in 2% of health people or 1% of health people, they don't have lung cancer, but X-rays will show some results, some intermediate results showing that probably this person has lung cancer. It's about 1%, 2%, depends on the system. Now, what is the probability that the patient has lung cancer? If he smokes, he comes in, says that he is a smoker, and X-rays test show lung cancer. So this is a question for a doctor. How can estimate? Because if the patient needs more, if the probability is high, probably the healthcare provider will order more tests and more exams and so forth. So this is a very important, actually, in this number, and talking to hospitals, I found out that this is actually information is very valuable in clinical medicine. And we use some public health data. As I said, for example, this data, we use 78% and so forth. So in this case, we are looking to use this formula, which is called Bayes formula. And we already covered this formula. And I will just remind you that in this formula, this is the answer to our question. So this is X-rays show cancer. And what is the probability that this person is sick? So if, for example, the X-ray show cancer, and what the probability is that this person is really sick. So what we need a priori information for that, according to the Bayes formula. And this a priori information that this person is a smoker. Okay, actually, in what I did also some work in priori information, we use more parameters, but I showed just an example of them. So we use just that this person is smoker. So we use this PS that the doctor has a priori information that is 20%. Okay, we know that people who smoke, they develop lung cancer. That's what this PS means. What does it mean, PRS? So PRS shows that this is, as we know, and we discussed it in previous lectures, it is conditional probability. Probability that this person is sick, and X-ray shows that he is sick. All right? And divided by PR, which is full probability. Okay, full probability. And we will talk about full probability in more detail in a second. So first of all, we'll just put this table of numbers that we are going to use. The first one, it is a priori information. And this one, in data science, we call it is evidence or additional observations that comes from this additional information come from measurements, from observations, right? So it's called observation, additional information, whatever. And PR, it is full probability, which we are going to talk in a minute, and I'll refresh your memory. What does it mean, full probability? So in this case, we already know many things. We know a priori, and we know observations because doctor sent this patient to do X-rays. And we know that X-rays, if a person's sick, they will catch this disease in 75% of sick people. The X-rays show that accurately show this. They have disease. So this is already we know, which is 75. So 0.75. One thing we do not know is PR, because when we have this full probability, we put this and we have right away we estimate, and we'll see how the probability jumped from, or maybe sometimes goes down, from 20% to having this information, okay, additional information. And what happens that the doctor actually sent this person who came to see him for his appointment. He sent him to X-rays, and X-rays showed that this person indeed has lung cancer. Okay, so we have 0.75, but not 100%, 75%. So now we'll see what's going on. PR, we can estimate as a full probability, and I will show also, remind you what does it mean PR, but PR will be the probability zero point 0.2 times 0.75. It's exactly what this numerator is. Plus, what is 0.8? 0.8 are smokers, but do not have lung cancer. We know from here, if 20% of smokers have lung cancer, 80% do not have lung cancer. That's what is 0.8, because 80% is 0.8. And what is 0.02? 0.02 is the accuracy that a person is healthy. So the person is smoker, but doesn't have, or he or she, they don't have lung cancer, okay? And this is a probability that these people, they do have cancer. So it will be 0.2. So this is probability that they have cancer, X-ray showed, but actually they do not have lung cancer. So this is a full probability, and this is 2% because 100% minus 98%, okay, that people do not have lung cancer, and X-ray show they don't have lung cancer, but 2% they do not have lung cancer, but X-ray show they do have lung cancer. And this comes to 0.166. We put this number in the denominator, and we have the result, which is 90%. So with 90%, the doctor now sure that this person who is a smoker and the lung cancer show that X-ray show that he has lung cancer, or she, that the probability jumps from 20% as a smoker to 90%, because X-rays already, although they are not 100% accurate, they were useful to estimate that now the probability that this person with a positive X-ray showing indicating that he has lung cancer plus he is smoker gives you 90%. Okay. If we have more evidence, we again use this. For example, the doctor orders more tests. We have more. Again, this formula we use because we take now this as a priori information. We use the same. We have kind of chain, and we can estimate how the new evidence and new observations will affect. It goes up or down. But with this 190%, it's already indication that the person should be or start a cure treatment, or the doctor may order a new additional tests. But this is a very valuable information for the doctor. Now, I would like just to remind you, what does it mean, conditional probability, because many of them, you know this, but I just want to be sure that you remember. What is conditional probability? Suppose you work for a public health agency. Let me just put it here, something. Yeah. Suppose you work for a public health agency, and you have a community where 30% are skillful workers and 70% are unskillful workers. It's just, again, an example. Now, the income for skillful workers is over 50K per year. And for unskillful workers, it's 20K per year. And 80% of skillful workers, they make 50K, so not everybody. And 20% unskillful workers, they make 50K per year, so 80% make less than 50K per year. So this is statistics, what you got it from the, let's say, Social Determinant of Health organization about community. And you have to find out what's the probability that a person makes in this community over 50K per year. And this is exactly what this problem was. We used this in our previous example, this one. Okay, that we are going to examine here. So what we do, we take, let's say, a square. And here is skillful workers, it is 30%. So this distance is 0.3, 30%. And unskillful workers in this community, 0.7. Okay, so we have 0.7 plus 0.3 equals 1, so it's 100%. Now, this is very, very easy. So we have this probability 0.3 plus 0.7 gives you 100%, so 1. But what happens here, that 80% of skillful workers make over 50K. So we will just put this and make shadows here, so shadows. And we find out that this one is 0.8. So the length of this side is 1, this is 0.8. Now, what is the area of this shadowed rectangular? We have to take the length of this side, which is 0.3, and multiply by 0.8. And this is our conditional probability that we have the group of people that are skillful, right? We take this skillful people, vertical bar, and this is 0.8. And this is conditional probability. So this means that we have skillful people in here, and not all of them, but 80%, they make over 50K per year. This is called conditional probability. And please remember that all conditional probabilities can be expressed in terms of area of the total square or rectangular. So the total rectangular for skillful, it is 0.3 times 1, but with condition that it's only 80%, it will become 0.3 times 0.8. So this is area. And this is what do we take these skillful workers, okay, and this is 0.8. And same thing we do for unskillful workers. It is 0.7, this side of the rectangular, times now we have 0.2. We have only 20%. They make more than 50. So we have to sum these areas, and we will have 38% or 0.38. So this means that 38% of the community residents, they have their income is greater than $50,000 per year. Okay. That's what it is. Very, very simple. So just remember that this one is just, you have to find out areas, and this area, this one, this will be, we call it P, A, vertical bar, B. This is a total event. So this is all residents, skillful residents, and A, in this case, these residents who make over 50K. And we calculated that the income of this population, of this community, who make more than, so 38% of residents of this community, they make over 50K per year. All right, thank you.